Hello and welcome to Health Diagnosis. Today we're going to talk about a very common yet often misunderstood condition, jaundice. You might have heard people say someone looks yellow or their eyes have turned yellow. That's usually a sign of jaundice. But what exactly is happening inside the body when this occurs? Let's understand it step by step. Jaundice itself is not a disease, it's actually a symptom. It's the body's way of signaling that something is wrong, usually related to the liver, the gallbladder, or the red blood cells. The yellowish color we see in the skin, eyes, and sometimes even the nails is caused by a substance called bilirubin. Bilirubin is a yellow pigment formed when red blood cells break down. Normally, the liver processes this bilirubin and helps remove it from the body through bile. But when the liver can't do that properly, bilirubin builds up in the blood, and that's when jaundice appears. There are three main types of jaundice depending on where the problem starts. The first is prehepatic jaundice, which happens before the liver, usually when there's too much breakdown of red blood cells, such as in conditions like malaria or certain anemias. The second is hepatic jaundice, which happens due to problems inside the liver itself, like hepatitis, alcohol-related liver disease, or cirrhosis. The third type is posthepatic or obstructive jaundice, which happens after the liver, usually when bile flow is blocked due to gallstones, tumors, or inflammation in the bile ducts. Now, how can you recognize jaundice? The most visible sign is the yellowing of the eyes and skin, but other symptoms often appear too: fatigue, nausea, loss of appetite, dark-colored urine, pale stools, and itching of the skin. Some people may also experience fever, abdominal pain, or swelling in the upper right side of the abdomen. If you notice these symptoms, it's important not to ignore them, because jaundice can indicate serious liver or gallbladder problems that require medical attention. Doctors diagnose jaundice by first looking at the symptoms and then doing a physical examination. Blood tests are crucial. They measure bilirubin levels and check how well the liver is functioning. Depending on the results, imaging tests like an ultrasound, CT scan, or MRI may be done to look at the liver, gallbladder, and bile ducts. In some cases, a liver biopsy might be needed to identify the exact cause. Treatment for jaundice always depends on the underlying cause. If it's due to an infection like viral hepatitis, the focus is on rest, hydration, and antiviral medicines if needed. If alcohol is the reason, complete avoidance of alcohol is crucial to allow the liver to heal. When gallstones or blockages are the problem, surgery or other procedures might be needed to clear the obstruction. In newborns, jaundice is common and usually harmless, but when levels rise too high, phototherapy, a special light treatment, helps break down excess bilirubin. For adults, lifestyle changes play a big role in recovery and prevention. Eating a balanced diet rich in fruits, vegetables, and whole grains supports liver health. Avoiding excessive alcohol and processed foods is essential. Always take medications only as prescribed, because many drugs can stress or damage the liver when used inappropriately. Staying hydrated and maintaining a healthy weight also help the liver work efficiently. Prevention, as always, is better than cure. Vaccinations for hepatitis A and B can protect against major viral causes of jaundice. Safe hygiene practices, such as washing hands, avoiding sharing needles or razors, and being cautious with street food and contaminated water, can prevent infections that affect the liver. Regular health checkups and liver function tests are also helpful, especially for people who consume alcohol or have a history of liver disease in their family. Jaundice can range from mild and temporary to severe and life-threatening. The key is not to self-diagnose or ignore it. If you or someone you know notices yellowing of the eyes or skin, dark urine, or a persistent tiredness, it's important to visit a healthcare professional right away. Early diagnosis and proper treatment can make a huge difference in recovery and long-term liver health. Your liver is one of the most hard-working organs in your body. It filters toxins, produces bile, stores energy, and helps with digestion. Taking care of it means taking care of your entire system. A healthy lifestyle, safe habits, and timely medical advice can go a long way in keeping jaundice and liver diseases away. Thanks for watching Health Diagnosis. If you found this video helpful, Don't forget to like, share, and subscribe to our channel for more health-related information and awareness videos. Stay healthy, take care of your liver, and see you in the next video.